All right, on to a very serious subject matter, scoliosis. It's a common condition that can affect children and teenagers who are going through that rapid growth spurt. I just saw my youngest one shoot up over the last couple of months. Not that he's dealing with this, but they grow so quickly. Dr. JJ is here, and one of our producers who went through this herself, Michelin Moore. Welcome.
Yeah, thank you.
Good to have you here. What is scoliosis exactly?
Okay, so simply put, it is a curvature of the spine. Typically, it's a lateral curvature. So the spine normally, if you're looking at a person straight on, goes up and down, absolutely straight. As you see, this forms almost a C in this direction and another C here, which turns into kind of a lazy S. And so the curvature can happen at any point in the spine. It can happen in just this dimension, but it also can happen in this dimension. So there can be rotation attached to that, and these can be quite complicated. There are three kinds of scoliosis in kids. The first is called congenital, and what that means is that the vertebrae, which are each of these individual bones that articulate in the back, the vertebrae don't form normally, and they may actually fuse and not separate from each other. So that's obvious at birth. The second is called neuromuscular scoliosis, and that happens when the muscles on either side of the vertebrae may exert an uneven force, causing increased growth on one side and not the other. And so we see that commonly in conditions like cerebral palsy, muscular dystrophy, and also in things like spina bifida. And the most common cause, which we're really going to focus on today, is called adolescent idiopathic scoliosis. And what it means is that we don't know what the cause is. It's thought to be multifactorial, has a little bit of a genetic component. About 30% of people have it in their family. And it's most common in females. So females are 5 to 8 times more likely to have idiopathic scoliosis in their teen years than boys are. So that's why it's more in the language of girls than in the language of sons.
Why are adolescents more at risk?
Well, when you think about Kai as a perfect example, there's a rapid growth spurt where most kids in a typical year before puberty will only grow 1.5 to 2 inches a year. But during the growth spurt, they may grow 5, 6, 7 inches over a 1 to 2 year period of time. And when there's a rapid impetus to growth, sometimes the bones get a little confused and one side grows a little bit more than the other, or the muscles on one side take over on the other, and before you know it, you've got a curvature of the spine.
Right. Are there common signs, like you can just look at it and go, is that where you see it? Is it too late then, too?
Sometimes it's obvious. Clearly, there's no symptoms early on, so this is a painless condition. So unless a parent is actually able to see their kid in a bathing suit or in their underwear, or if a physician is able to have a kid partially disrobed so you can really screen for them, often these go unrecognized. But typically a teacher or a school nurse who's screening, or in your case, your ballet teacher, right?
Yeah.
Or a healthcare provider like myself will see things like this. So this is kind of a typical illustration of what we might see. We see one shoulder higher than the next. We see that the little wing bone or scapula here is higher than this one. So asymmetry or lack of equality is one. You can actually see the curve in the spine in this child. And then really, if you really focus down here, see how there's more room between the waist and the arm than there is here. And there's actually a crease on the side too. So all these certainly sum up to raise the index of suspicion, but sometimes it's not that obvious.
Well, we have our producer, Michelin Moore, with us, who you've actually been through all of this at a very young age. So what was your experience with scoliosis?
When I was about 12 years old, my ballet teacher noticed a misalignment in my hips. And although I did have a pretty severe curve, it wasn't that noticeable just by looking at me. So you really had to be kind of examining my posture. So she suggested that I go get x-rays taken. And when we did that, they discovered a pretty serious lower lumbar curve. So I immediately went into wearing a brace at that time. So from about 12 to 14, I was wearing a brace. Yeah, there's my x-ray.
So
that's your x-ray?
Yeah.
In Michelin's case, we don't see anything really subtle here. And if what your ballet teacher saw was just an asymmetry of the hip, often these curves look very dramatic on x-ray. And what they are is, if you can imagine a string of beads not only pushed this way and this way, but also rotated, the sum of that may only show something externally, and yet you've got a very, very serious, complicated curve.
Was
here.
this painful?
I was going to say, I
that
have
hurt you?
some back issues, and it's just,
Yeah.
you must, were there nerve pins?
Well, yeah, it was mostly muscular. I mean, because when the spine is shaped like that, it pushes all your muscles out of place.
Yeah.
So there was a lot of muscle pain, even though you couldn't really tell by looking at me.
Right.
So there definitely was pain there.
Well, they could certainly tell by looking at you, you're wearing a brace.
Right.
You did
yeah.
that for 2 years?
2 years during middle school, which is the worst time to have anything that's, this is exactly what it looked like.
And this is called a Boston brace. It has to be worn 23 hours a day.
Oh.
Yeah. So I would take it off during like dance practice and stuff, but it was on all the time.
So that was on, you took it off, everything went well after that?
So it continued to progress, and about 2 years ago, it just got to the point where the curves were still progressing, and I was still in a lot of pain. So I bit the bullet and had a spinal fusion surgery where they put in 2 rods and a bunch of screws and locked it in place. There it is.
Here it is. Right.
So these are called Harrington rods.
Wow.
And you have to understand that when you have complex curves like this, you need to stabilize the spine above and below. Just like when we cast a broken arm, we cast above it and below it. So in this case, this is a big surgery. These are hours in the operating room, a lot of risk for blood loss, lots of hardware, and titanium, isn't it?
Titanium.
Does it hurt? Are you in pain?
I am not in pain at all anymore, which is amazing. I have, bad days here and there, but I'm in so much less pain than I was.
Was this the only option, doctor? Is this all that?
Well, here's the good news. Only about 1/10 of kids diagnosed with scoliosis need treatment. And of those kids that are close to ending their growth, if they have mild curves, we just observe them. If they have a lot of growth left, we watch them periodically, and if we start to see progression of the curve, they're in a brace right away. And braces typically, when you just have normal garden variety scoliosis, will stabilize you so that there's no progression.
Right.
But there's a small percentage of folks, and you are one, who have progression even after the growth centers are done doing their thing. And that's when we run into problems with pulmonary, lung problems, heart problems, breathing problems, pain issues.
Yeah.
And this can be quite disabling. So your only option that's evidence-based is using the Harrington rods and a spinal fusion. But fortunately, it's a rare event. But when you have it, it's a game changer, right?
Yeah.
Can you just go back a little bit when you were in school? How difficult was it for you to be in this brace for 2 years at school?
Yeah, well, it was middle school, so that's, the worst of the worst.
Yeah.
So, it was embarrassing. It was really I had just moved to a new school at that time too, so it was just like a lot of things that made me different at that time. So it's not fun. You don't want that to be your child.
And you need a lot of support. You need a lot of support from your community, your family, a lot of self-confidence, and it takes active work.
Rehab?
For the surgery, minimal actually. I mean, I was back. I had an amazing surgeon in New York, Dr. Baton, who did a great job, and I was getting massages and stuff like that. But it wasn't. I mean, I was probably back on my feet in 2 months.
Wow, and you're I know, that's great. And today you're what? You're good?
I'm great. I'm really good, yeah.
Can you pass the scanners at the airport?
Yes, because it's titanium, but yeah.
All right.
How do you diagnose somebody?
Yeah.
Okay, so typically the screen that we do is called a bend over test, and so if we have a graphic of this. Okay, so what we do at every exam, and I started when my kids were 3 in the practice, whenever they were able to cooperate, with bare feet and your back bare, you bend someone over, and clearly in this person you see a straight spine, and you could put a level across this, across the shoulder blades, and they would be level. Now, when there is scoliosis, you may see an obvious crease here, an obvious curve here, a raise of the shoulder, but we actually have a little level with a marker on it that helps us define the number of degrees. And anything that came close to 10 degrees, or if we had lots of signs on the back, we refer to orthopedists. 3 sets of x-rays are taken standing from the side and also bending over to look at all aspects of the curve, so it's 3-dimensional. And with surgeries like yours, sometimes even MRIs are done to really define the curve.
Sure.
And even those 3D printers, they will print a copy of the spine so that they know how to untwist it. So technology is helping us quite a bit.